Hi, this is a presentation on creating a philosophy of nursing. It was designed for nurses and nursing students. My name is Pat Clay. I have a Master's of Science in Nursing. I am an RN in a compact state. I am a certified pediatric nurse, and I have certification in wound and ostomy care. Wow, philosophy. When I say that word, does a blank sheet of paper come to mind? Where do I start? What do I draw? What colors will I need? Well, creating a philosophy about anything is kind of like that. But creating a philosophy about something might be one of the most important and useful exercises that you do. So, philosophy is simply a way of thinking about something. A philosophy is created from or informed by your experiences, your knowledge or things you know or think you know, beliefs about things, and your culture and traditions. The philosophy you hold drives your actions and how you behave. It guides the decisions that you make. It informs your work and how you relate to others. Let's look at an example. Let's take a philosophy about eating. When I think about eating, I think a balanced diet with a variety of different foods is best for nutrition. I think moderation is best with attention to serving sizes. I think food should be tasty. I think eating can be enjoyable. I think eating nutrient-dense foods is best to avoid the use of supplements. I think food can be used to connect with other people and strengthen bonds because everyone has to eat. These thoughts about food were formed from my experience with food and family and culture, my knowledge about nutrition. Here is a summary of my philosophy of eating. I think eating a balanced diet with nutrient-dense foods that do not require supplementation is best. I think that eating in moderation with specifically portioned foods makes eating more enjoyable and healthy. I think the use of seasoning to make food tasty is delightful and pleasing and makes eating enjoyable. I think eating with others can be a pleasurable experience promoting positive relationships. Okay, so here's how I practice my philosophy of eating. Because I think eating a balanced diet with nutrient-dense foods that do not require supplementation is best, I will learn about which foods are nutrient-dense and research ways to prepare these foods for best nutrient and taste. Because I think that eating in moderation with specifically portioned foods makes eating more enjoyable and healthy, I will learn about portion sizes, eat slowly, and push away from the table when I feel full. This chart here shows a remarkable comparison of serving sizes 20 years ago and then today. A 3-inch bagel 20 years ago was 140 calories. A 6-inch bagel today is considered a serving size and is 350 calories. Same with the cheeseburger, a portion of spaghetti, a soda pop, and fries. Why don't you supersize it? Okay, let's continue with my philosophy of eating. I think the use of seasoning to make food tasty is delightful and pleasing and makes eating enjoyable. Because I think that, I will learn about different spices and their uses and keep a variety of fresh spices on hand. And because I think eating with others can be a pleasurable experience promoting positive relationships, I will invite others to share a meal at least once a week. Okay, now that we've thought about food and developed a philosophy of eating, let's think about my job as a nurse. The things I think about when I think about my job as a nurse are my relationship with my patients, my relationship with other care providers, my relationship with coworkers, my relationship with leadership on the unit that I work on, and my relationship with the organization where I work, and my relationship with the profession of nursing in general. Let's put on our thinking cap. Here we go. You ready to dive in? Each component of this philosophy will have a goal and then actions to fulfill that goal. Back on slide number 3, we looked at what informs our development of a philosophy or how we think. What informs my goals? Well, my culture tells me to care for others who cannot care for themselves. My religion holds the belief that caring for others who cannot care for themselves is rewarding. My knowledge of nursing theories tells me to encourage independence in my patients. My experience with other healthcare disciplines tells me that I need to ascribe to their expertise for best outcomes. And my personal experiences with friends and family inform my goals. Dialogue with fellow students and coworkers also informs how I approach nursing. And many other experiences and interactions have developed my way of thinking about my job. Okay, my relationship with my patients. The goal is to provide the best care for my patients. Here's the actions I will take to do that. I will learn about my patient's medical diagnosis, symptoms, and treatment plan. Whether I'm at work or not at work, I have a collection of books at home, I have the internet access, and at work I have special resources like UpToDate. I will strive for excellence in nursing skills required to care for my patients and have ready resources to consult that will augment those skills. I will integrate nursing theory into my practice, such as change theory, adult education theory, to enhance my patient care skills. I will practice an attentive and respectful communication style. I will spend time with my patient to learn about them as a person and to better assess any subtle dysfunctional patterns in actions or behaviors. Remember, we don't learn from talking, but we learn from listening. I will follow safety standards, identifying my patient, administering medications and treatments, and maintaining privacy. I will anticipate possible adverse events and be prepared to respond. How about my relationship with care providers? Well, the goal there is to advocate for my patient through collaborative practice. Here's the actions I will take to fulfill that goal. I will follow care provider orders according to the standard of care. I will keep care providers informed regarding patients' response to treatments and orders and any new problems. I will attend rounds and be an active participant with relevant, accurate information. Because I advocate for my patients, I will escalate concerns that are not adequately addressed. With patient permission, I will consult nutrition, social and spiritual services as issues are identified that require that expert care. I'll strive for professional, friendly, and respectful relationships with all members of the healthcare team. How about my relationship with coworkers? Well, the goal there is to foster professional, friendly, respectful relationships with the common goal of providing excellent patient care. The actions I will take to fulfill that goal are: I will practice excellent communication skills that are respectful and friendly. I'll be prepared for a report on my patients, making sure there is time for questions from oncoming staff. I will communicate clearly and frequently with assistive staff regarding delegated tasks and rationale. I will promote effective teamwork, assisting my coworkers as I am able. and I will request assistance from my coworkers as needed to ensure patient safety and best outcomes. How about my relationship with leadership on my unit? Well, the goal there is to support leadership in my attitude and my actions. To do that, I will be attentive to communications from leadership team via email or postings and attend required staff meetings. I'll actively participate on committees to which I am assigned, representing and advocating for my unit to the best of my ability. I'll keep leadership informed of any adverse events or emergent situations as they arise, and I will not engage in criticism of leadership, but instead I'll seek opportunities to give input and feedback. How about my relationship with the organization? Well, the goal there is to serve the organization I work for with the highest level of expertise for the best outcomes. I will support the mission and vision and the strategic plan through my actions, providing input and feedback as requested. I will direct any issues or questions I have about the mission, vision, or strategic plan to my immediate manager, reporting to higher leadership levels as necessary. I will follow rules and guidelines of the organization as they uphold patient safety and standard of practice. I'll strive to accurately and favorably represent my organization in the community, being aware of sensitive and privacy issues. How about my relationship with the profession of nursing in general? Well, the goal there is to promote the profession of nursing through my personal presentation of the profession. How will I do that? Well, I'll work toward the expert level of my profession through lifelong learning and skill attainment. I'm never going to stop learning. I'll represent my profession in a positive light and address challenges at the local and greater levels as able, maybe becoming a member of an association. I'll encourage anyone interested in the profession to pursue a nursing career, pointing out the many specialty areas. I'll subscribe to the ethics, clinical, and professional standards of practice embraced by professional nursing organizations. Okay, let's revisit the components of my philosophy so that we can summarize my philosophy. It's about my relationship with my patients, care providers, co-workers, leadership, the organization for which I work, and the entire profession of nursing. Okay, so now let's summarize my philosophy of nursing. I will strive to provide the best possible care for my patients and advocate for my patient through collaborative, patient-centered practice. I commit to professional, friendly, respectful relationships with the common goal of providing excellent patient care. I endeavor to support leadership in attitude and actions as I serve the organization I work for with the highest level of expertise for best outcomes. As I participate in my community and circle of influence, I will promote the profession of nursing. Well, thanks for watching. To view more narrated PowerPoint presentations for nursing students, go to my YouTube channel at Prof. Clay A+ Clinicals. You can also email me at profclay2020@gmail.com.